look up to him whenever we talk about rabies. So, like when talking about adult vaccination, we are all thinking of routine immunization only, right? But other than routine immunization, there can be immunizations in some special situations, like in some emergency cases, like rabies and tetanus, etc. So, sir, can you please tell us about the status of rabies vaccination in the government sector and the private sector now, and what do you think about that?
Now, one thing, we are dealing with such a disease that is a 100% fatal disease. The main thing, because if we go through the previous history, we'll see that at least we are losing 20,000 patients every year. But the most important part is that these are the vaccine preventable disease. So coming to it, now the need for the adult immunization, particularly vaccination program, there are two things are very important. One is the pre-exposure prophylaxis, another is the post-exposure prophylaxis. Although the children are also being a victim, moreover, the adult, the number of the patient death, if we search out, we try to find out the number of the patient death, their age, also many adult patients are dying every year. And now, in the last 2017, we have gone through it. Now the figure has come down to near about, it is 12,000 or 10,000, something like that. Now, the APCRI is working, no doubt about it. The government should come out very methodically, because each and every patient needs the proper pre-exposure prophylactic doses. If we can give this one, at least we'll be able to, we have a target of a rabies-free country by 2030. At least we'll be able to cut down the figures. And definitely one day will come by 2030. It is our WHO target, and the Indian scenario, NCDC, is having the same target along with our APCRI, our association, that will come down to definitely will be able ultimately control of rabies throughout the India. My take-home message to each and everyone: don't ignore this fatal disease, because it is a vaccine-preventable disease. At least if there is any kind of dog bite, it should be dealt with separately, meticulously, so that we'll definitely will be able to control rabies. Another important part is the usage of rabies immunoglobulin along with the vaccination is very much important. So there should be some strict, rigid rule that the primary and pre-exposure vaccination should be needed. And if we get, the main advantage is the incoming of the post-exposure time, the patient will get already only 2 doses of vaccine. So the role of adult immunization, particularly in the field of rabies, has got immense importance. So I think definitely we'll be able to control rabies by administering the proper dose of vaccine in each and every patient throughout the country.
Right, sir. So rabies is a 100% fatal disease, and vaccination is probably the only way out. Coming to rabies, we can think of another organ which is equally important to us for clearing all our dirts, the liver. And we know a host of viruses can infect the liver. And for most of these viruses, we have vaccination, which people often miss. So, Dr. Indrajit Tiwary, with your huge experience of vaccines for liver, can you please elicit us on what you see in your clinical practice and what you see as the way forward?
Thank you, Dr. Basu, for giving me the chance, for the organizer giving me the chance. Really, I am privileged and honored to put my thought process in this August forum. Basically, since I am working in a specialized critical care, that is gastrocritical care, I usually come across the patient with liver failure, acute liver failure, chronic liver failure, or acute and chronic liver failure. And when I saw these patients are suffering from hepatitis A-related chronic liver disease, or this patient is having fulminant liver failure due to hepatitis A, we have a great shock. Immediately I asked myself why we are not encouraging people for this hepatitis vaccination. Because fulminant liver failure due to hepatitis A In last 10 years, at least we have do 5 to 6 transplant in acute liver failure related to hepatitis A, which was a totally preventable disease. So since being the immunization schedule is very simple, for hepatitis B, you have to take 3 doses, and hepatitis A, you have to 2 doses at an interval of 6 to 12 months. So that sort of simplicity is there. In spite of that, we are unable to put forward the thing in the public domain. So when I am leading the adult immunization program in Apollo, I was in lead. What I did in my department, in my hospital, I try to make the awareness more frequently. So we put a different OPD clinic, like adult vaccination clinic in gastro ward. When people coming for the liver clinic, by side they are seeing a vaccination clinic, adult vaccination clinic. Similarly, we posted a similar counselor in a room in the gynae department and in medicine department. So we have 4 or 5 clinic running in different department with a good counselor, which can who can counsel them and make them aware what is the importance of this vaccination, hepatotropic viruses. Since hepatitis B, whatever you do, you can control the disease, but ultimately it is leading into a good amount of chronic liver disease. And hepatitis A, for the clinical part, I would like to say you 2 or 3 things, important things regarding the titer. In the subset of people who are listed for liver transplantation or kidney transplantation, organ transplant, solid organ transplantation, usually we do the titer level even you have the, because the response rate in this dialysis, ongoing dialysis patient or chronic liver disease patient, the seroconversion is less. Suppose in normal population it is 95 to 97% with 3 doses or 2 doses. In this special subgroup, it is only up to 66%. So in that case, you have to give a 4th dose or booster dose, or you have to repeat the whole vaccination schedule to prevent the disease. Second important thing I would like to highlight, what we have observed in last 5 to 6 years, last decade, with the development of this MRI PDF, fibroscan, and other scan, which can detect the fatty liver NAS, particularly in diabetic groups. They are most vulnerable to develop chronic liver disease. And very rapidly it is increasing NAS, non-alcoholic steatohepatitis leading, like in diabetic leading to the chronic liver disease. This subgroup of patients should be vaccinated at high target. So what we are planning, we plan to put a counselor or vaccination coordinator at endocrine department also. Those who are diabetic or who are being pre-renal failure or in CKD, this should be vaccinated. So I think for the medical perspective, we have to keep in mind the vaccination schedule, the titer level, and the risk group. And for the public domain, I think we need to aware. If you are making family to aware, that can be a great thing. And if the doctors fraternity take the challenge, individual department take the challenge, then only it can happen. Definitely with the help of the government support in mass. Yeah, Dr. Ribu.
So thank you, sir. And coming to your point that how can we make the people aware? You have experimented with the counselors in the OPDs. So I am coming directly to one of the questions asked by one of our spectators. This question is for Dr. Harivansh Chopra, with his huge experience in like operational aspects of vaccination. The ones related to healthcare knows or have knowledge about the requirements of adult vaccination, but even in the allied classes of society, they try to avoid this vaccination. So what can be done to promote immunization among all these commoners? Sir, please.
Okay, thank you, Rivu, for asking this particular question. You must understand that I always say that yes, medical science has made a lot of advances, and vaccination has gone a tremendous change. And from 6 vaccines now, even in the immunization program, we are having more than 10 vaccines. And again, the role of the government is of great importance. Now, coming back to the question that why even the elite class does not take the vaccine, there could be 2 reasons. You must understand. I can share my experiences because I started immunization in 1985 in my field practice area, and I know how I build over it. You must understand that whenever we talk of patient for treatment or we talk of giving vaccination, there is one factor which is very, very common in India, that the practice is still till date today is faith-based. The patient has complete faith on the treating doctor. And that is one way to enhance. if the treating doctor tells the patient that this is essential and this is for the betterment or for your life, this will prevent the occurrence of number of diseases if you follow the advice. There is no reason that the patient will not follow that advice. You have to understand, if you are treating somebody and then you are advising the relatives of that particular patient who are not taken treatment from you, it will be a difficult phenomenon. But if you are treating a patient and you are telling him or his family member, definitely they are going to listen to you. And this was the only reason. I'm not talking of individual. If I'm saying my model was appreciated by the state government, by the local government, by the local authorities, and now they are collaborating with us, that they are providing everything to our center. We don't have to procure anything. We just have to give vaccination. Why? Because we have developed faith over a huge community. And you must understand that you are the treating doctor. So you have to club these two things together. And like what doctor was saying, that yes, when they put the counselors, why they are putting the counselors? Because they don't have time to explain. But the counselors, if the doctor says the counselor is going to talk to you, again, it is taken as advice of the doctor. The counselor worked on the advice of the doctor and the patient is going to listen. The point number 2, which is again important, as far as hepatitis B and A, I wanted to come in at that particular point of time. Hepatitis B is there in the universal immunization program, but hepatitis A is not there. And then we'll have to understand that we have to give the vaccine prior to the exposure of that particular disease. So again, yes, we need more data. If we can produce more evidences and data, then hepatitis A can be included in the immunization program. And if it is given right in the childhood, then a lot of mortality due to hepatitis A can be prevented. So this is my take on that.
So, sir rightly talked about vaccine hesitancy, and we know how a problem it is in the under 5. And